Our Heart of the Valley focus on breast cancer awareness continues. We've partnered up with South Texas Health System for this effort. And joining us today is Dr. Martha Cano with STHS Clinics. Thanks so much for being with us today.
Thank you for having me.
So, you know, the numbers tell the story. 1 in 8 women will develop breast cancer in their lifetime. What are some of the warning signs that we need to be looking out for?
The most common warning sign is a lump or a palpable mass. A lot of times it's self-detected. So I encourage women to do self-breast exams and to get to know.
And they need to do that every month, right?
Yes.
The self-breast exams.
They should do it monthly and just be very cognizant of your anatomy. You know when there's asymmetries, know when there's a change. Sometimes it's not a mass. Sometimes it's a change in the texture of the skin. It may look like an orange peel. It may be thickened. Sometimes there's redness. So all those things can be a sign of something concerning.
And if we see that, what do we need to do?
Call your doctor.
Right away.
Right away. Use your instincts, and any change in the breast, an inverted nipple that is new, is also something that needs to be evaluated. So you should see your doctor and count on some diagnostic tests, either a diagnostic mammogram or an ultrasound, regardless of age.
And what are some of the risk factors?
Risk factors are genetics, either a family history or a true genetic mutation. You may have heard of BRCA1 or BRCA2. Those are true genetic mutations that highly increase people's risk for breast cancer. Other risk factors, there's things that you can change and there's things that you can't. So you can't change your genetics, you can't change your ethnicity, but we can change our lifestyle. And decreasing alcohol intake, not smoking, regular exercise, a healthy diet, and interestingly, these things help with a lot of other cancers and medical problems. An anti-inflammatory diet or something like the Mediterranean diet does reduce the risk of breast cancer, and decreasing alcohol intake. Even one alcoholic beverage per day can increase your risk for breast cancer.
All right, so if we do all of these things, we can help reduce our chances of getting breast cancer.
Yes.
What about if we have a family history? How soon should we be getting screened?
It depends on the age of the person with breast cancer, and it also depends on their BRCA status, or if it's a true genetic mutation, because that definitely involves some genetic testing and a lot of potentially difficult decisions that need to be discussed in detail with your doctor. So if it's a family history but not a genetic mutation, testing or beginning screening 10 years before that patient was diagnosed is a good starting point. And also discussing your history with your doctor so that you can be guided in a clear pathway.
And very quickly, what's the most important thing we can do in this fight?
Get your mammogram. It's as simple as that.
Once a year?
Once a year. Once a year, starting at age 40. After age 75, it should be a mutual discussion between the patient and their doctor. But out of all the things that we can do or should do to prevent breast cancer, getting your mammogram is number one.
All right. Well,
mammograms save lives.
We thank you so much for joining us today.
Thank you for having me.
You know, we cannot stress this enough. If caught early, the survival rate is very high.
Absolutely.
Okay. Well, here's what you can do. You can take advantage of reduced price mammograms. All month long, South Texas Health System is offering 2D mammograms for $100. 3D mammograms are $155. To set up an appointment, visit southtexashealthsystem.com/thinkpink. We will be right back.